My name is Charlotte Martin, and this is my informative speech for SPT 1608.
Matt.
Josh.
Lauren.
Hannah.
Clay. Eric.
Scott.
And I'm Corey.
Thank you guys for coming today. I'm here to speak to you about the importance of your annual eye exam. Unlike our teeth or our stomach even, our eyes don't hurt when there's something wrong. Periodic eye and vision examinations are an important part of preventative health care. Healthy sight is about seeing well now and into your future. Being in the career field that I am, I get patients all the time that think, oh, I have perfect vision, I don't need to see the eye doctor. And that's not always the case. Many times I sell glasses to people who don't realize that what they weren't seeing wasn't actually perfect vision at all. Even patients with the need for corrective eyewear should still be seeing their eye doctor at least every other year. Sometimes children have an amblyoptic eye. That means one eye has more power than the other. So over time, if not caught at a young age, they'll sometimes start to have an inward turning of the eye. If not corrected by the age of 7, this is permanent. There's nothing really you can do. This child is going to be stuck with a lazy eye, sometimes even having to wear a bifocal. It's really important to stay with your annual eye exam, so I'm going to kind of go over a little bit of information with you guys today. Checking the eye health is an essential part of the vision exam and can reveal important information, such as if you have diabetes or high blood pressure even. Early diagnosis and treatment of an eye and vision problem is important for maintaining good vision and eye health. I kind of quoted this from Dr. Dayton today. During a comprehensive eye exam, your eye doctor does much more than just determine a prescription for eyeglasses or contact lenses. He or she will also check your eyes for common eye diseases, assess how your eyes work together as a team, and evaluate your eyes as an indicator of your overall health. The first point, of course, is when you're seeing your eye doctor, your vision testing and correcting decreased vision is trying to get that patient to what they call perfect vision 2020. This is important for daily activities, driving even. Common signs, you might need a refraction error. If your eyes are tired by the end of the day, if you start to notice you're having a problem with nighttime driving, glares are a little bit more bothersome, and you're starting to hold things maybe a little bit closer than you were before. If visual acuity is not corrected to 2020, we need to know why. Is there something ocular going on? And better vision means a better life. For example, people who suffer with vision problems are restricted in many ways, such as nighttime driving, reading even. Just an example, my mom is 44. She's one of those people who's had perfect vision all of her life, and now all of a sudden she's starting to find she needs help. And one of the things that affects her is nighttime driving. So if you invite her out somewhere and it's night, she'll even tell you, I can't go, I don't drive at night. And you're 44 years old, you should not be driving at night, So that's just an example of one of the things that your vision not being corrected could affect you with. Another point I want to make about seeing your annual eye doctor is that early diagnosis and treatment of eye and vision problems are important for maintaining good vision and eye health, and when possible, preventing eye loss. For example, glaucoma, it's known as the silent killer because you really have no indication, no signs beforehand if you have glaucoma. It leads to blindness. It's known as the silent killer, and is the second leading cause of blindness. The eye examination can also detect a number of other underlying health problems, such as high blood pressure or diabetes. Sometimes going to your normal MD might not be enough when it comes to preventative health care. Going to your eye doctor, they can actually tell from the blood vessels in the back of your eyes if you have the early signs of these diseases. There's very many different vision-threatening ocular diseases, such as cataracts. I'm sure we've all heard of. We live in Florida. We're all going to have cataracts by the time we're 50. Glaucoma, neoplasms, high myopia even. Early detection is the only thing that can lead to prevention to successful intervention. How often should anyone be having an eye exam, you're probably thinking. It varies between children and adults. Most children need to have their first eye exam by 6 months. Your pediatric doctor will tell you that. And before they start school, they need to have their first eye exam. Of course, if there's corrective lenses, they'll be needing an eye exam every year. Like I said earlier, as a child, you really need to have their eyes examined because sometimes you might not even notice they have an inward rubbing off their eye. It might just be very slight, like at the end of the day when they're tired and that eye kind of relaxes in. It really needs to be corrected at an early age. For adults after 40, it needs to be every other year, and after 60, sometimes it's every 6 months or just at a year. If you're diabetic or have high blood pressure, you need to be seen every day. In conclusion, I just want to talk about, another quote that I have here from Dr. Surratt is, healthy sight is defined as an enhancement of the overall everyday quality of vision and the prevention of long-term ocular health. Simply put, is you want to see well now and you want to see well into the future. The best way to protect your precious sight is through prevention, having those normal eye exams. The eyes are most important sensory organ. It's the window to the world and the prerequisite for active life. Sometimes people who don't even think that they have issue with their eyes will come to the eye doctor and find out, they need help with their vision. And sometimes it's different. I worked for an ophthalmology office in Ocala for a few years before I moved here. And I remember I had this one patient, Miss Wright, I'll never forget her. She came in for just a normal eye exam. She actually had failed her driver's license test, so she's just in for a normal refraction. And I noticed throughout, while I was doing her baseline and workup, she kept rubbing her eye and kept saying that it hurt. So I came over waiting for the doctor to come in, and I'm just examining her eye, and I noticed an extra piece of tissue that was growing over her eye that I noticed when I lifted her lid and she looked down. And so I told Dr. Ringo about it, and when he went to the room, he found out she actually had a tumor. It's something that when she had just had an exam done at her normal doctor's a year prior, they hadn't even caught. So there's many things, that should make you want to go have a normal eye exam. It's very important for your health. If you have anything wrong with your vision, or it could happen to you in the future, such as glaucoma, the only way to know is to have that preventative care. If you want any more information about your eyesight or vision, a couple good websites you can check out. Allaboutvision.com, I was just on there earlier this morning. They have a really great story they just posted today. Q11 eye healthy eating foods you could be having, and they kind of have a review of eye allergies if you have anything ocular going on or any information about contacts, and also thinkaboutyoureyes.com. Thank you guys.